ਸਿਟੀ ਆਫ ਬ੍ਰੈਂਪਟਨ ਮੇਅਰ ਪੈਟਰਿਕ ਬਰਾਊਨ ਨੇ ਪ੍ਰੋਵਿੰਸ ਨੂੰ ਅਪੀਲ ਕੀਤੀ ਹੈ ਕਿ ਲੈਜਿਸਲੇਟਿਵ ਚੇਂਜਸ ਕੀਤੀਆਂ ਜਾਣ ਤਾਂ ਕਿ ਓਵਰਡੋਜ਼ ਦੇ ਨਾਲ ਜਿਹੜੀਆਂ ਡੈਥਸ ਹੋ ਰਹੀਆਂ, ਜਿਹੜੀਆਂ ਮੈਂਟਲ ਕ੍ਰਾਈਸਿਸ ਹੈ, ਉਹਨਾਂ ਨੂੰ ਟੈਕਲ ਕੀਤਾ ਜਾਏ। ਜਿਹੜਾ ਡਾਟਾ ਦੱਸਿਆ ਪਿਛਲੇ 5 ਸਾਲਾਂ ਦੇ ਅੰਦਰ 700 ਤੋਂ ਵੱਧ ਜਿਹੜੀਆਂ ਡੈਥਸ ਹੈ ਓਵਰਡੋਜ਼ ਨਾਲ ਹੋਈਆਂ। ਸੋ ਅਪੀਲ ਕੀਤੀ ਗਈ ਹੈ ਪ੍ਰੋਵਿੰਸ ਲੈਵਲ ਤੇ ਕਿ ਲੈਜਿਸਲੇਟਿਵ ਚੇਂਜਸ ਲਿਆਈਆਂ ਜਾਣ ਤਾਂ ਕਿ ਸਾਡੀ ਜਿਹੜੀ ਪੁਲਿਸ ਫੋਰਸ ਹੈ ਉਹ ਜਿਹੜੀ ਇਨਵੋਲੰਟਲੀ ਜਿਹੜੀ ਟ੍ਰੀਟਮੈਂਟ ਹੈ ਮੈਂਟਲ ਹੈਲਥ ਦੀ ਕ੍ਰਾਈਸਿਸ ਔਰ ਓਵਰਡੋਜ਼ ਦੀਆਂ ਜਦ ਹਸਪੀਟਲਸ ਜਾਂਦੀਆਂ ਸਾਡੇ ਹੈਲਥ ਕੇਅਰ 'ਤੇ ਬਰਡਨ ਪੈਂਦਾ ਔਰ ਪੁਲਿਸ ਫੋਰਸ ਜਿਹੜੀ ਹੈ ਉਹ ਆਕੂਪਾਈਡ ਹੋ ਜਾਂਦੀ ਹੈ ਇੱਦਾਂ ਦੇ ਕੇਸਿਸ ਸੰਭਾਲਣ ਨੂੰ। ਸੋ ਇਹਦੇ ਲਈ ਲੈਜਿਸਲੇਟਿਵ ਚੇਂਜਸ ਦੀ ਜ਼ਰੂਰਤ ਹੈ। ਦੇਖਦੇ ਹਾਂ ਮੇਅਰ ਬਰਾਊਨ ਦੀ ਆ ਸਟੇਟਮੈਂਟ।
We want to speak today about an issue that is impacting our community and communities across the province and country. We are calling on the province of Ontario to implement a compassionate and necessary solution for individuals suffering from severe addictions, concurrent mental health disorders, and brain injuries. As we like to refer to this as compassionate intervention. On September 15th, British Columbia made a significant announcement expanding involuntary care for individuals facing concurrent addiction, mental illness, and acquired brain injuries. They also unveiled plans for high security facilities under the BC Mental Health Act. You know, BC has sort of been on the forefront of challenges with addictions, and they've had some very tough conversations about how we can help. This conversation that they've had in British Columbia is long overdue in other parts of the country. The approach from British Columbia offers a vital lifeline for those in crisis, helping individuals regain control when addiction obstructs their ability to seek help. It's why we have reached out to the province to request a pilot project occur here in Brampton and in Peel region. The current voluntary treatment framework, while effective, leaves a significant gap for those unable to seek help due to the severity of their condition. And I want to share with you today the data that we have seen that I believe really highlights why this is merited. We know that between January of 2022 and June 2024, there was a total of 1,851 police-attended overdoses in Peel region. And sadly, there was 328 fatal overdoses. Many of these fatalities had prior overdose occurrences, and so I cannot stress enough the importance of early intervention and intensive treatment. By prioritizing timely interventions, we can reduce harm, promote recovery, and foster a healthier, more resilient community where everyone has the opportunity to rebuild their lives with dignity. The same old approach isn't working. I don't want to hear about hundreds of more overdose fatalities. The collaborative strategy is essential to ensuring every individual has access to care and support they need, ultimately enhancing community safety and well-being. The recent policy shift on the West Coast reflects a crucial step in tackling the growing challenges of mental health and addictions, which intersect with homelessness, housing insecurity, and encampments. I know Councillor Santos has been outspoken about the challenges we face with encampments here in Peel region. In Brampton, like many cities, we are witnessing the profound effects of mental health and addiction issues exacerbated by the housing affordability crisis. Mental health and addiction, homelessness are not just social issues, they are pressing public safety concerns. Our emergency services, hospitals, and shelters are experiencing, and this is not an overstatement, unprecedented demand as these challenges grow more complex. Peel region is facing a drug toxicity crisis with 705 lives lost in the last 5 years. In 2023, Peel region experienced 573 opioid-related emergency department visits and sadly 147 opioid-related deaths and 34 deaths so far just in 2024. Fentanyl was a key contributor in 9 of the 10 of these deaths in 2022 and 2023. Since 2010, visits to Brampton's Mental Health and Addictions Emergency Department and Urgent Care have surged by a staggering 121% compared to the provincial average of 54%. We're feeling this in Brampton. Since 2022, Peel Regional Police have received 33,891 calls specific to mental health and addiction crises. This is only a small portion of the calls for services associated with these issues, but 33,000 since 2022 to the Peel Police. Since that time, there were approximately 12,000 apprehensions by the Peel Regional Police of 8,000 individuals at a rate of almost 14 mental health apprehensions per day in Peel Region. We have one instance locally where the individual had 53 apprehensions. This is not police doing police work. This is police having to fill the void because government hasn't acted. As first responders, Peel Police spent 30,000 hours waiting in a hospital since 2022, rather than on the front lines protecting the community. Among the 8,200 who were subject to mental health calls, nearly 3,000 were subject to additional calls to police, illustrating that mental health and addictions are root cause in a wider range of police occurrences. This is 11,340 frontline officer shifts, and obviously a huge impact on our police budget.
The growing number of overdoses and substance-related deaths highlights the urgency of addressing this crisis through a compassionate and holistic approach. It's something we've been asking all orders of government many times, especially when dealing with the homeless population. While voluntary treatment is always preferable, there are instances where compassionate intervention may be necessary to protect the well-being of individuals and the broader community. This treatment should be seen as a last resort, used only when an individual poses a serious threat to themselves or others and when less intrusive measures have been completely exhausted. Respect for human dignity is paramount. Compassionate intervention should focus on rehabilitation and reintegration rather than punishment or control.
Thanks for addressing this issue of overdose deaths, and every region needs it. Since you want to see the legislative changes at the province level, but we have seen that indigenous people, they are being not given the disability benefit because the trauma they are seeing for generation and generations. Seniors, they are facing the mental health issues. These overdose deaths, not only in Peel, but across the country, across the regions. So legislative changes in the provincial level, but what you need to see through federally, because you are the one who was the biggest advocates for the bail reforms. And in this also, what changes you want to see at federal level also, so that overdose deaths can be tackled across the country, and this mental crisis, even seniors can be helped with that. Thank you.
So in terms of this policy, although the legislative authority for it would be on a provincial level, obviously having all levels of government work towards this would be helpful, and having the government of Canada continue to invest in a more significant fashion into treatment would help. Obviously, what we see in British Columbia, this is coinciding with treatment at the same time, is absolutely necessary, and so to have the federal government supportive is obviously would be very helpful.
In British Columbia, we had seen that decriminalization of hard drugs like fentanyl, that also happened there. So you are not in favor of that because that is not the solution, what we think, to stop the overdose, or you are not in favor of that?
No, I do not support decriminalization of additional prohibited substances in this country. And obviously in British Columbia, they revisited what was viewed as a failed policy. But once again, that's a completely separate conversation. Today is about compassionate intervention.